Regarding ECG changes associated with ACS, which one of the following statements is true? A. 70% of patients with AMI have a diagnostic ECG. B. Pseudo-infarction patterns mimicking STEMI on an ECG may be secondary to pulmonary embolus and subarachnoid hemorrhage. C. Discordance of the QRS complex and ST segment or T wave in the left bundle branch block is suggestive of myocardial ischemia. D. ST segment elevation of more than 1 mm in 2 or more contiguous chest leads meets reperfusion criteria. Pause the video and answer. Answer is B. Pseudo-infarction patterns mimicking STEMI on an ECG may be secondary to pulmonary embolus and subarachnoid hemorrhage. There are multiple mimics of STEMI including bundle branch block, pacemaker, cardiomyopathy, pericarditis, myocarditis, pre-excitation, hyperkalemia, benign early repolarization, ventricular hypertrophy, pulmonary embolism, subarachnoid hemorrhage. Up to 50% of AMI have normal or non-diagnostic ECGs. A clinical decision rule developed by Scarbossa attempts to predict the likelihood of AMI in a patient presenting with ischemic symptoms and LBBB. This rule consists of a scoring system based on ST segment elevation is greater than or equal to 1 mm concordant with the QRS complex. ST segment depression is greater than or equal to 1 mm in V1, V2 or V3. ST elevation is greater than or equal to 5 mm discordant with the QRS complex. Only 1 to 2% of patients presenting with ischemic symptoms to the ED have a new or presumed new, not known to be old, LBBB. The first Scarbossa criterion, ST segment elevation is greater than or equal to 1 mm that is concordant with the QRS complex, if present, seems to be the most specific in diagnosing AMI in those patients. However, the Scarbossa criteria have a limited sensitivity in diagnosing AMI in patients with LBBB. In clinical practice, because of their low sensitivity, these criteria may not be helpful. Any diagnostic test criteria should be highly sensitive to diagnose a critical condition such as AMI. Patients presenting with ischemic sounding chest pain and ST segment elevation of is greater than or equal to 2 mm in 2 or more contiguous chest leads and is greater than or equal to 1 mm in the limb leads meet reperfusion criteria.